Hello everyone, I'm Dr. Miller. I'm a naturopathic doctor and I specialize in dermatology, specifically identifying and treating the root cause of chronic skin conditions such as acne, eczema, and psoriasis. Today I'm going to be going through the GI map results for an acne patient. What the GI map is a comprehensive stool analysis that uses quantitative PCR technology to detect DNA of various microbes in the gut. It also looks at other intestinal markers, which you'll see. I like to run this on all of my skin patients. I just find it incredibly helpful. I think it's just the best way we can get the most information about the gut all in one test. I also ran an organic acids test for this patient, but I'm not going to be going through those today. I'm just going to be going through the GI map, but I will say that Candida was high on the organic acids test, which I do mention in my GI map videos as well. A little bit about this patient. This is a female in her 30s who had been experiencing acne for about 8 years, started in college, and mostly on the cheeks, jawline, and chin. She tried all kinds of things such as, various supplements, over-the-counter topicals, some prescription topicals, elimination diets, things like that. Nothing had really made any difference, and no triggers that she could think of, right? Like didn't really get worse with certain foods, at least immediately, didn't change with menstrual cycle, didn't seem to be affected by stress, kind of just around all the time. The other important factor about this patient is that she'd been struggling with chronic digestive symptoms for years as well, bloating, urgency, loose stool, etc. Those were also some key symptoms for her. This patient also has high testosterone, which was confirmed via serum labs. I worked with her and we ran the GI map and the OAT, and I'm going to be going through the GI map. So I'm going to insert those clips now, and then I'll talk about what we did for treatment at the end. All right, so this is page 1 of the GI map, the pathogens page. All of these are normal for this patient, which I generally see. However, with chronic digestive symptoms, every once in a while I do pick up on a pathogen that was previously contracted and that just never fully resolved. So I was happy to see this page was normal. Next, HPylori was high. HPylori is a bacteria that colonizes in the stomach and can overgrow in the stomach. It has specific virulence factors that help it survive with the stomach acid and cling on to the lining of the stomach. It also produces urease to lower stomach acid, which is how it survives in the stomach. The problem with this, though, is with low stomach acid, we can run into other symptoms like digestive symptoms, maldigestion, and therefore malabsorption. And then other microbes can survive because the stomach acid is lower when we would normally want the stomach acid to kill them. So there's a higher risk for things like Candida and SIBO when we see H. pylori here. Next is the commensal and keystone bacteria page. This is what we think of as the microbiome, so like the beneficial gut microbiome. We want these to be present in healthy, normal amounts. We don't want them, however, to be too low or too high. Overall, this patient looked really great. Most of the numbers were in the green zone, which is what we want. There was one species that was low, but since everything else was looking normal, I was actually really happy with the microbiome, probably because this patient hasn't really taken antibiotics and eats a very high fiber diet. So they're doing a really good job feeding the good bacteria. I do want to point out, so this first section are specific species of bacteria that they point out. You'll probably notice Bifidobacterium and Lactobacillus. Those are really common species that are in probiotics. I do want to point out too, just for reference, Akkermansia and Faecalibacterium. If these two are low, that's an indicator of potential leaky gut. All of them play a role in your gut barrier function, but these ones are especially important. So if those two are low, that's one of the signs of leaky gut, but this patient looks pretty good. And then, so specific species here, this next section here looks at the phyla, so it kind of zooms out and looks at the overall picture. So you might have a couple species that are low or high, but if the overall phyla look good, that's what's really important. Or you might have like all these individual species might be in the green zone, but we'll see that the Bacteroidetes or Firmicutes phyla are in the red zone, like too low, which just means an overall lacking of good gut bacteria. So overall, this patient's microbiome looks great. Next, we have the opportunistic microbes. So these are not in the pathogen family, but they're also not part of the beneficial gut microbiome, and they can just be present in the gut. However, when they start to overgrow and are present at high levels and start to crowd out your good bacteria, that's when they can cause a problem. They can cause digestive symptoms. They can contribute to a lot of inflammation in the gut and leaky gut, and ultimately skin symptoms. So we don't want a lot of these to be high. Her enterococcus was high, as well as the streptococcus. Everything else looked okay. And then none of the inflammatory bacteria, which was good. I was happy about that. Then it goes through fungus and yeast. So yeast, it's really hard to get yeast to show up on the GI map, which is why I like to do the organic acids test. This patient's organic acids test showed arabinose was high. So there's definitely the presence of candida overgrowth. And then the viruses were normal. Parasites and protozoa also negative. All right, and the last section of the test is intestinal health markers. So first two are markers of digestion. So steatocrit is fecal fat. That was undetectable, which is good. We don't want fat to be showing up in the stool because it tells us for whatever reason you're not digesting and absorbing fats very well, and probably other things as well. Elastase is pancreatic elastase. This one looked okay. Usually when this is slightly reduced and H. pylori is high or present, it's due to H. pylori and the lower stomach acid. So, I'm okay with this, but, if it's low, there could be some pancreatic insufficiency, or it could be because of the H. pylori or low stomach acid. Next is beta-glucuronidase. This is something that's produced in the gut, produced by certain bacteria, can interfere with glucuronidation in the gut, which is part of detoxification. Occult blood was undetectable, which is always good. Secretory IgA, okay, maybe borderline high. So secretory IgA is part of the gut mucosal immune system. So all your mucous membranes in your body, so GI lining, the sinuses, vaginal canal, etc., all our mucous membranes, and they all have their own immune system essentially before things can enter the body and get into the bloodstream. So secretory IgA is part of that immune system in the gut. If this is really high, obviously that tells us your immune system is overactive, secreting antibodies, like something is triggering it, right? So it could be foods, so it could be sensitivities, allergies, it could be pathogens, etc. So this was okay. And then if it's really low, that tells us it's probably been high for a long time and almost just so depleted that your immune system is no longer mounting a successful response. So that's kind of one of the key symptoms as well of leaky gut if the secretory IgA is very low. Antigliadin IgA, if this is high, gluten is extra inflammatory in the body, in the gut, and in the body if that is high. So this one was okay for her. Eosinophil activation protein, that's another inflammation marker. Hers was looking really good. And then calprotectin, another inflammation marker. If this is really, really high, so when I've seen this actually be an indication or sign of inflammatory bowel disease, so like Crohn's disease or ulcerative colitis, usually it's in the thousands, so I'm seeing it extremely high, and often like the secretory IgA will also be extremely high. So if that comes back in the several hundreds or thousands, I would definitely send them to gastro, or at least repeat the calprotectin again just to compare and make sure they don't have like Crohn's disease or ulcerative colitis. Usually if it's just in this bar line, like so still under 173 but high or medium, it's just usually due to other inflammation going on in the gut, which is still a problem, but at least it's not like an autoimmune disease like such as Crohn's or UC. In my time working with this patient, her acne is completely resolved now, which is really exciting. Some of the things we targeted obviously were what you saw on the GI map. We really focused in on H. pylori. We just did various supplemental treatments such as mastic gum. And then for the candida, I just rotated with various herbal antifungals. And then we did some broad spectrum antimicrobial herbal formulas and just individual herbs to treat the other overgrowth. Also did just, digestive support. I added on digeszymes, which has oxbile, various digestive enzymes, and HCl, since we know stomach acid was probably low because of the H. pylori. And then we did some other work, reducing inflammation in the gut and helping with the integrity of the gut barrier. So humic and fulvic acid, glutamine, things like that. In addition to treating the gut, we also worked to bring down testosterone levels with supplements such as inositol. And she's on a maintenance plan now, so acne is totally clear, and she's just on some foundational things just to help with digestion and to keep that testosterone down. But other than that, and she's on a really great skincare routine as well. But her acne is completely clear, which is very exciting after 8 years. Yeah, if you have any questions, let me know. If you're interested in having a GI-MAP or organic acids test run yourself, all my information can be down below. I work with clients one-on-one, and I would love to work with you or anyone you know to help find and treat the root cause of your chronic skin disease. I hope this was helpful. If you enjoyed it, make sure you give it a like, follow my channel for similar videos, and I'll see you in my next video. Bye.